Everybody, why is health insurance so hard to understand? It is so hard because you have so much jargon in there. Networks, deductibles, co-pays, maximum out-of-pockets. And then you're like, but wait 1 second. I met this, but I haven't met that. This doctor's a network for this plan, but it's not in this plan. It accepts you this carrier, but not this specific carrier. Why has got to be so difficult? It's frustrating. Even as agents, we struggle sometimes. And we're like, this doesn't even make sense. My name is Joe with Quantum Insurance Advisors. We help our clients with many different things from Medicare, life insurance, annuities, but we also help with ACA and health insurance. So let's get into it. So life insurance is just hard to understand at times. Some people have a PhD in it and they understand it perfectly. But for most people, it's just hard where you're talking about the co-pays, the deductibles, the maximum out of pockets, this network, this tier of drug, all these different things. And you're like, thank goodness for us, we use tools to help us understand it. We're obviously going through training year round, but when we sit down with a client, we ask them all these questions and we try to simplify. Tell me, what kind of plan do you currently have and what do you like about it? Do you prefer an HMO or PPO? Why? Because that's an important separation as well. What prescriptions are you taking? And then we enter in all that information into our platform and it starts uploading and giving us what plan suits your needs best. It tells us based off of your prescriptions and doctors, which one might suit your needs best. But the one thing that platform can't do is figure out what really works best for you. Why? Because when you're sitting down with one of our agents, they're asking you more personalized questions. They're finding out if your doctor that you're visiting is one that you really enjoy seeing, or is it something that's kind of, obviously you're gonna enter in the doctor, but maybe by having that conversation, like, I really don't feel comfortable the way their bedside manner. I don't feel comfortable with their bedside manner. I don't feel comfortable with this. Well, I have a relationship with this doctor and I hear nothing but great things about this specific doctor. Maybe this could be a good fit. That's where an agent comes in, a local agent comes in and helps you out because they're able to guide you, because we're visiting doctors' offices throughout the year. We're having these tours because doctors also want to grow their panel, but how do they know to grow their panel? Is by talking to the agents. But we also have clients that are visiting them to confirm what the doctor's telling us. So it's not just what the doctor says, but it's also what the community says. Working with a local agent is not just about, hey, he's local and he can tell me about this. It's about what makes you feel right. It's about that connection that you have with your doctor, your plan, and your agent. So when you're working with the ACA plans and you're saying, this is just hard, know that there's an agent that's willing to help you to make it easy. And you don't have to worry about, man, I'm scared to go to the doctor because I'm not sure what my bill's gonna look like. Well, that's what your agent's there for. They can help guide you with the benefits, the co-pays, and all those different things. You might be wondering, how do I know that this agent's up to date on everything that's going on? Every year we have to do a recertification just to make sure that we're ready to sell ACA plans or health insurance. But the other thing is that our team, most of our agents, will go to conferences throughout the year to be educated on what's going on in our industry. So there's a few different conferences that I attend a year just to make sure that I'm informed. But as an agent, my job, as a principal agent, my job is to be informed. So I'm always having conversations. I'm reading articles. I'm on websites. I'm on forums, just to make sure that I'm up to date on everything that's going on in our industry. So be sure that our agents, when they're helping you, that they're up to date on everything that's going on in our industry, that to make sure that they serve you best. Now, if you like this information and it was helpful to you, like, comment, subscribe. But also, if you have any questions about your specific needs, give us a call.